In this video, I will be explaining how to use the CPT Codebook. CPT stands for Current Procedural Terminology. So what we will be focusing on in this video is coding procedures, medical procedures, and we will not be focusing on the actual diagnosis. So moving forward, make sure to remember what CPT stands for and that this video focuses on medical procedures. Intro to CPT Coding. The textbook that was used for this presentation is the Medical Coding in the Real World by AHIMA. Procedural coding. Diagnostic coding is the first half of coding, and the second half is coding for any procedures performed. Reporting the actual services, treatments, and procedures performed by the healthcare provider. There are 3 code sets that include procedure codes. They are ICD-10 PCS, CPT, and HCPCS. Both CPT and HCPCS code sets have been adopted for use by the Centers for Medicare and Medicaid Services and are known collectively as HCPCS codes. CPT codes are considered level 1 codes, and HCPCS codes are considered level 2 codes. Because they are published, created, and maintained by different organizations, it is important to learn the basics of each codebook separately, as they differ greatly from one another. CPT Code Structure and Purpose. CPT codes are 5 characters in length, beginning with at least 4 numbers and ending with either a letter or a number. The majority of CPT codes are entirely numeric. Unlike ICD-10 CM codes, CPT codes never change in length. They will remain 5 characters no matter how detailed the reported healthcare procedure is. Each CPT code identifies a specific procedure or service performed by the healthcare provider. So, for example, code 40808, biopsy, vestibule of mouth, identifies a surgical procedure in which a tissue sample was taken from the inside of the cheek for examination. This code reports the specific surgical procedure performed by the provider, which will be reported to the insurance company, along with the ICD-10 CM code to identify the medical necessity for the biopsy. There are CPT codes for thousands of different healthcare procedures, ranging from office visits, anesthesia services, and surgeries to radiological services and lab procedures. The different types of healthcare services or procedures are divided into 3 categories and assign numerical code ranges that are 5 characters long. CPT codes are organized with similar procedures grouped together numerically. So in other words, similar procedures or those procedures on the same body system all begin with the same numbers. CPT and HCPCS coding are completely different from ICD-10 CM coding. Not only do the codes identify something completely different, which is a procedure, service, or supply, as opposed to a diagnosis, but they are formatted differently as well. At first, the differences may be confusing, but as you work more with all of these code sets, you'll be able to recognize the different code sets and their uses will become like second nature. When assigning CPT codes for services, coders should select the name of the procedure that most accurately describes the service performed, not one that is simply like the code being described. Category 2 codes are completely optional. They are not required to be reported on any claim and are not reimbursable. So they are never paid directly. They are intended only to facilitate data collection for performance measurement purposes. Category 3 codes are a set of temporary codes used to report emerging technology services, procedures, and service paradigms. Like I said before, when assigning CPT codes for services, coders should select the name of the procedure that most accurately describes the service performed, not one that is simply like the code being described. Many times, healthcare procedures vary by only a small detail, such as the time involved in performing the procedure or the approach to the surgical procedure. CPT coding relies heavily on a close reading of the healthcare provider's documentation of the service that was performed. Any further procedures performed at the same time are reported with additional CPT codes. So, for example, if a provider performed a biopsy of the vestibule of the mouth and the incision and drainage of a simple pilonidal cyst, then each of these two services would be reported with the appropriate CPT code. So you would report the 40808 for the biopsy vestibule of mouth and 10080 for the incision and drainage of the cyst. In some instances, multiple procedures are bundled into one code. Like the ICD-10-CM codebook, the CPT codebook includes a tabular list of all CPT codes as well as an index and several appendices. CPT codes are divided into 3 categories. Category 1 codes are the largest set of codes in the CPT codebook and are commonly referred to as just CPT codes. Category 1 codes are divided into 6 sections and make up the majority of the CPT code set. These sections group similar procedures together, such as radiology procedures or anesthesia services. The different sections help coders navigate the codebook by grouping similar procedures together. However, codes from different sections of the CPT book are not exclusive of each other, so coders may report procedures from all sections of the CPT codebook if necessary. Guidelines specific to each individual section of the CPT codebook are provided at the beginning of each section, and these guidelines provide rules on how to use the respective CPT codes and offer additional information and advice about how to code correctly from each section. The CPT Index is located directly after the appendices. It's the last section of the CPT codebook. The index functions much like the ICD-10-CM index by listing the main terms of a procedure and then referring the coder to the corresponding CPT code. This allows coders to look up the main terms for a procedure to find the correct procedure code. Once the main term is selected, any modifying terms and cross-references are followed until a code can be selected. What did the doctor do versus why did the doctor do it? Example, a kyphoplasty was performed on a patient with age-related osteoporotic compression fracture of the thoracic spine. So in this example, let's ask ourselves, what did the doctor do? The doctor did a kyphoplasty to stabilize the spine. The CPT code for that would be 22513. The next question would be, why did the doctor do it? And this would be where your medical necessity comes in. You have to prove with the ICD-10-CM code that the diagnosis prompted the procedure. So for this one, the diagnosis is osteoporotic compression fracture of the thoracic spine, and that would be I-10 code M80.08XA. To determine the procedures from the documentation, the coder is going to ask themselves, what did the doctor do? The answer to this question should identify the verbs or actions performed by the healthcare provider, such as an examination, a surgical procedure, or other healthcare treatment. And to help discern the diagnosis from the documentation, the coder should ask, why did the doctor do it? And the answer to this question should provide the reason why the procedure was performed by the healthcare provider. And was it medically necessary? Looking up a CPT code. So the first thing you will do is locate the main term in the index, followed by checking for subterms or cross-references, and then you will verify the code in the tabular list. There are 4 primary classes of main terms. There are procedures or services, organ or anatomic site, condition, and synonyms, eponyms, and abbreviations. So that's what you're going to be looking for in the main index. Once the main term has been located, the coder will check for any modifying terms and cross-references. Modifying terms in the CPT index are much like subterms in the ICD-10-CM main index and function the same way. Modifying terms alter the main term. They are indented below the main term and present different versions of the procedure. Cross-references direct coders to other main term entries that may need to be referenced. Once the term that identifies the procedure has been located, the coder will refer to the code on the right-hand side of the column. Sometimes there may be multiple codes listed or a code range. Although they may represent the same procedure, each different code will include a specific detail regarding the procedure. Once the code has been located, it is imperative to verify the codes in the tabular list. The tabular list of the CPT code book is the listing of category 1, 2, and 3 codes, which are organized into a special format, which is laid out in sections, subsections, subheadings, categories, and codes. Example, the patient had a computed tomography of the brain without contrast. So the answer is going to be 70450. On the left-hand side of the screen, the very top picture where it says computed tomography CT, and then it says CT scan, that is the very first thing I looked for in the index. So I was looking for computed tomography, and the cross-reference tells me to see CT scan. So then I went in the index to CT scan and I found brain, and it gave me a code range 70450 to 70470. The middle picture is of the entire page of the CPT codebook. You can see there's a section, a subheading, and then I've highlighted where the code is located on that page. And then the right-hand side of the screen is a picture of it close up, so you can easily read it. So you can see 70450, computed tomography head or brain without contrast material. And then it gives you some options below that, but that's for a later video. Thanks for watching.